Hi, I'm Dr. David Warwick of Warwick Chiropractic here in Lacey, Olympia, Washington, and I have Kirsten. She's a mom of four, and a husband who's a local dentist in the area. And she came in, she actually, I believe, found me online. And so I'm going to introduce you to some of the techniques and things that I do here in the office and how I adjust her. Most of her complaints tend to be up in the upper neck area, mid-back area. So go ahead, if you can lay face down for me. So I'll take you through what's considered a chiropractic evaluation. Every chiropractor, just like every dentist, every doctor sees and views it differently because their license allows them to give their professional opinion and practice how they see fit. And there's some areas that are up to each individual practitioner. So here we have a right short leg on this side. So a lot of times that can indicate something misaligned in the pelvis or up in the upper neck area. Her leg's short, about 3/4 of an inch. It goes longer in position 2 and 3, and the left one goes a little bit further. So getting fairly close to that. It's right in the pelvis area, but more so in her sacrum. So the first thing that I'm going to do is actually adjust the sacrum to the side. So both legs are even, position 1, 2, and 3, and you can see how both legs started moving closer to the pelvis, so the range of motion improved. That'll reduce a lot of tightness that happens in the hamstrings and the quads right here. But I still feel a little bit on her right side of the pelvis here, so go ahead and lay on your left side. Now I'm doing more of a traditional style adjustment. When you go to a chiropractor, this is part of the Palmer methods. And face down. Many times the chiropractors will recheck the area, make sure they clear that as much as possible, and you can see how the range of motion improved right through there. Today's kind of a music day a little bit. We got a little bit of 70s rock going on. You can laugh at that, Kirsten. Right in the middle spine, right there. And right in the upper dorsal area, right by the shoulders. You originally found us, you were having a pretty bad headache, if I'm not mistaken, when you first came in.
Yep, I have migraines.
How often do you get them?
A couple times a month.
And do you feel like when you go to a chiropractor it's beneficial, it helps?
Oh yeah.
You come in fairly quickly though when it comes on.
Yeah,
you don't usually wait.
No, I know if I get it fixed, then I can feel better faster.
How many visits would you say you notice the headaches start to decrease with the treatment, or how many visits does it take before you notice improvement, I should say?
Oh, definitely just one. I know I notice a great difference.
Okay, so I'm using the massager to get some the muscle tissue to relax a little bit, bring some fresh blood to the area. You're right-handed, aren't you? So a lot of her shoulder, the muscles are more developed on the right side of her mid-back and the shoulder area. I could see that right through this area. And sometimes when people use one arm more than the other, especially when you have children, you hold them on one side more than the other, that area tends to tighten up right through the mid-back and shoulder area. Okay, let's have you go ahead, lay on your back for me. So sometimes chiropractors will check for full range of motion. I tend to use more of a passive feeling in the joint. I try to feel how it's moving back and forth while it's in a stationary position. We're right at C2, C1 on the left. Good. We'll we'll check her shoulder area. I'm going to place my hand right near the clavicle and the humeral bone. I'm going to actually have you just move down for me just a little bit. So I like to adjust the shoulders, especially when people have a lot of mid-back shoulder pain. One of the things that I do is check for the motion, feel where it gets a little tight, and then have the table drop into that position. Nice and easy way to do it. We're going to check the opposite one. So if you experience any shoulder pain, mid-back pain, a lot of times it could be a rib, shoulder area that's misaligned. Just going to open this up just a little bit more. Good. It wasn't too hard on you. All right, go ahead and sit up. If you can let our viewers know how you came or why you came in for your visits.
I get migraines, and that's originally how I found Dr. Warwick. I Googled local chiropractors, read a bunch of websites, and his was the one that impressed me the most. He is fast, he treats the pain, and lets me tell him how my body's feeling instead of telling me how I should feel. And he's great. I've been to a few, and he's one of the best.
I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington.